Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Purine salvage deficiencies. It is nothing but looking at the Lesch Nyhan Syndrome. So Lesch Nyhan Syndrome as well as the adenosine. deaminase deficiency. So it is also known as the SCID. So what is this? The severe combined immunodeficiency is known as severe combined immune deficiency. So this adenosine deaminase enzyme deficiency is the major cause. So adenosine deaminase, the major cause of the enzyme, is one of the major causes of the SCID. It is also known as the Glanzmann-Reinecker syndrome. The Glanzmann-Reinecker syndrome. Next is the SCID is in patients are usually affected by the severe bacterial, viral or the fungal infections, and they early in life and other present with the interstitial lung disease and also the chronic diarrhea and also failure to thrive. Next is the Lesch Nyhan syndrome. The Lesch Nyhan syndrome is for the deficiency of the enzyme HGPRT. So HGPRT is hypoxanthine guanine phosphoribosyltransferase transferase, and it is nothing but an X-linked recessive disease. And the clinical features is it includes intellectual disability and also self-mutilation, the aggression. This is all Lesch Nyhan HGPRT deficiency. So you have hyperuricemia as well. There is gout, and treatment, if you see, it is the AF. So A here stands for the allopurinol and F stands for the febuxostat. To learn and grow daily like this, please do subscribe.